In the name of Allah, the most merciful, the most beneficent. Assalamu alaikum. Welcome back to the surgical anatomy of the neck. So let's start the submandibular region or the submandibular triangle. Head like this from the side. This area is the submandibular area. So if I make this anatomically, here lies a bone of the skull that is called mandible. Mandible. This is the only mobile and largest bone of the skull, which bears teeth here. It has two parts, mainly three parts. It has a ramus, a body, and a symphysis pubis or mentis. The ramus, the superior border of the ramus is notched here. Anteriorly, this is called the coronoid process. This is called the condylar process. Which articulates with the base of the skull and the bulge of which is seen in the floor of the external auditory meatus. Now, if you see the neck from side, as I mentioned before, if I draw here the hyoid bone like this, with the greater cornea here and the lesser cornea here, and this is the body. The muscle that was coming from here is the posterior belly of digastric, muscle, as I mentioned before, and it forms here a tendon which gives another belly that is called the anterior belly of digastric. This tendon passes through a fibrous sling. Now the same triangle, now we are looking from the side. This is the submandibular or digastric triangle. Here in this area, as I mentioned before, there is another bone that is called the mastoid bone, and here a styloid process. A muscle arises from here, from the styloid process, and this also goes to the hyoid bone. This muscle is called stylohyoid bone, stylohyoid muscle, which arises from the styloid process and attaches with the hyoid bone. From here, if I cut this mandible here like this, in this inner surface of this area of the mandible, there is a small projection that is called genial tubercle. This is called inferior genial tubercle because there is another one which lies above this, that is superior genial tubercles. So there are two tubercles, inferior genial tubercle and superior genial tubercle. From this inferior genial tubercle, a muscle arises and attaches with the hyoid bone. Now the name of this muscle will be a geniohyoid muscle. From the inner surface, if I draw the mandible here, again the inner surface of the mandible like this. From the inner surface there is a line projection that is called myelohyde line. From this line, a muscle arises posteromedially from both sides and insert on a median raphe and inserts on the hyoid bone. Inserts on the median raphe and posteriorly going to the hyoid bone. This muscle is now called myelohyde muscle. This forms the floor of the oral cavity. This muscle, now if I draw it here, it will look like this. Going posteriorly and downward to the hyoid. Now, almost all of the floor or base of this submandibular triangle is occupied by these muscles. From interiorly, this geniohyoid, then a big muscle, this myelohyde muscle, and from posterior is the another muscle that is called hyoglossus muscle. Hyoglossus. Now the floor is now occupied by geniohyoid, myelohyde, hyoglossus muscle, while a few fibers come also here. Middle constrictor muscle of the pharynx. Now the floor of this triangle is almost completely occupied by these floor muscles. Now the important thing lies in this floor or in this triangle is the gland, the submandibular salivary gland, as I mentioned before. It's almost a C-shaped gland with a larger outer part or superficial part and a smaller deeper part. The deeper part projects anteriorly, or you can say the posterior border of this myelohyde muscle has made a notch on this gland and what lies above this. So this is the submandibular gland. From the anterior tip of this gland arises the submandibular duct or the Wharton's duct, which pours the saliva from the submandibular gland into the floor of the mouth. If we draw the muscles of the tongue, the tongue lies here. Let me draw it black. The tongue lies here, like this. It has a superior longitudinal layer of intrinsic muscle inferior longitudinal muscles, intrinsic longitudinal muscles, vertical intrinsic muscles, and transversely lying. These are the intrinsic muscles of the tongue. Now, the extrinsic muscles, as I said on here, that is the hyoglossus, muscle, from the hyoid to the tongue. Another muscle from this genial tubercle, the superior genial tubercle, arises and insert in the anterior part as well as into the dorsal and the middle part. This muscle is called genioglossus muscle. The significance of this genioglossus muscle is that it holds the tongue in the oral cavity. It pulls anteriorly. It's the only attachment of the tongue here with this mandibular part. If it's cut, the tongue will go back. Now, from here, if we draw here the vascular arrangement in this area, here lies the internal and external carotid arteries. Here is the common carotid and here is bifurcation. The external carotid artery, the first branch is the superior thyroid artery. It goes to the thyroid gland. The second is the lingual artery. The third is the ascending pharyngeal part. And the fourth branch is the facial artery. This lingual will deeply anteriorly into the tongue, divided into a dorsal part and an inferior part. The facial branch goes deep to the superficial part of the mandibular, the submandibular salivary gland, and this comes out here, just between the superficial part, deep to the superficial part, and lateral to the mandibular, lower border of the mandible. From here, the facial vein comes anterior to this superficial part of the submandibular gland, which drains into the jugular system. Now, the nerves which are important in this area are the hypoglossal nerve, that we draw also red. The hypoglossal nerve lies a little lower here. Just superior to this gland lies another nerve that is called lingual nerve, which comes from the mandibular part of the trigeminal nerve. This nerve joins with another part, the cauda tympani nerve, a part of the facial nerve which carries autonomic secretomotor fibers to a ganglion that is called submandibular ganglion, while the sympathetic branches come from the carotids, from the plexus, from the internal carotid. A plexus, sympathetic plexus formed around the internal carotid. The sympathetic branches come to this ganglion from this area. These fibers supply taste fibers to the anterior tongue as well as secretomotor fibers to the submandibular gland and the sublingual salivary gland. Another part is the glossopharyngeal nerve. The glossopharyngeal nerve also comes to the ninth cranial nerve, to the posterior part of the basal tongue for taste and gag reflex. So if you draw the arrangement in the tongue, this is tongue midline. Deep to this is the ninth cranial nerve. Then the lingual artery, then the lingual vein, this is the arrangement in the body of the tongue, and laterally we come down to the submandibular gland. Laterally and inferiorly, we can say infralaterally becomes these facial artery, in the gland and the facial vein and the hypoglossal nerve. So if we draw here, there will be the facial artery, here the facial artery, here the submandibular gland, the superficial part, here the facial vein, facial artery, facial vein, 12th cranial nerve, and this is the gland, salivary gland. Therefore, doing operation in this triangle for removal of the submandibular gland, we must know about all these structures so that we can protect these structures well before removing this gland. So in the next video, I will discuss the different incisions we give in the neck as well as given for this submandibular gland. Usually we do, when we do submandibular gland excision, we give an incision just about 2 fingers below the lower border of the mandible, because there is a cranial nerve branch, that is the marginal mandibular nerve. It's a part of the facial nerve which runs just below this body of the mandible, about 1.5 centimeter, or let's say 2 centimeter below this border of the mandible. So we make an incision below this line. Thank you.